We constantly air stories on the obesity epidemic here in the U.S. That's also a global concern. Nearly 500 million people worldwide are considered obese, and this can lead to type 2 diabetes, high blood pressure, sleep apnea, among other issues. We also see the possibilities and options of surgery for this. Dr. Sajida Ahad is one of the few surgeons in the U.S. specializing both in obesity medicine as well as bariatric surgery. And thank you so much for joining us here with Mercy Medical Center. And who can be a candidate for this? We've seen this with some celebrities or maybe a few other people who are out there, but this can actually be done.
Yeah, we actually have very strict criteria, and we go by body mass index, BMI. So anybody with a BMI of 35 with a medical condition that is affected by obesity, like osteoarthritis, sleep apnea, diabetes, heart disease, and many, many more. Or somebody with a BMI of more than 40 without any medical condition would be considered a candidate for bariatric surgery.
I know many of us think about that BMI chart. Many people dreading it once you slide past like 25 and you're considered a certain point to 35. But once you're at 35 plus, I mean, that's a major complication to just life quality for a lot of people.
That is absolutely correct. Morbidly obese patient can live on an average 8 to 10 years less than a normal weight person.
How effective is bariatric surgery when it comes to for the long term to maintain for the weight loss?
Actually, only bariatric surgery has been proven effective in most patients for durable weight loss. Usually we say that most patients will lose 60% of their excess weight in the first 6 months after surgery and about 77% of that weight at 12 months. And most patients after 5 years of surgery will have lost and maintained that weight loss of 50% excess weight.
Okay, well that can be good for the long-term hope for it. Because,
absolutely.
But I imagine there's also a very much a stress on diet, exercise, everything else for once this is done with, just to make sure that that can be maintained pretty well.
Absolutely true. Diet and exercise actually remain the mainstay of treatment before and after surgery. Surgery alone will not do anything unless the patient follows the prescribed program.
How does the body bounce back from a surgery like this? Because I could imagine for a body, this is a very traumatic experience, though. Once you go into the surgery, you have some of the excess weight taken off, and then all of a sudden you're sewn up and then you're back at it.
Yeah, actually it has become a very effective and less complicated surgery than it was. The risk of dying from bariatric surgery is less than the risk of dying from gallbladder surgery or a hip surgery, for example.
Oh, really? Okay.
So we have come a long way, and it's improvement in surgical techniques, accreditation with American College of Surgeons, American Society of Metabolic and Bariatric Surgery, as well as laparoscopy ensures that patient has faster recovery, faster return to activity, less pain, and a more safer surgery overall.
One that might make it reaching that level where it's almost more routine as far as surgeries go. So that's good to see. Doctor, thank you so much for your time and enjoy the rest of your Monday. We appreciate you being here.